PAE is one of the emerging techniques in embolization, and it's been around for the last 10 years. So it has matured a lot in the last 10 years, but it's still very new to a lot of IR. So it's really important that CIRSE has dedicated sessions and focus sessions and workshops, as we're going to see in this scientific meeting this year. Just explaining how you should do the procedure and how to some tips and tricks on how to manage patients and how to perform PAE safely and in an effective manner. PAE is not a very easy procedure. I mean, everyone knows that PAE is actually a quite complex procedure. There are a lot of different reasons for that, and basically in my presentation, I will try to give a case-based examples of the many different reasons why PAE can actually be a nightmare in some situations. So we'll first focus on challenging pelvic arteries, for example, due to very tortuous iliac arteries and how to deal with this iliac tortuosity. And then we'll also discuss about very challenging prostatic artery origins, for example, when you have a lot of atherosclerosis, very angulated arterial origins, how to deal with microcatheters and wires to overcome these very challenging origins. And then we have the variant anatomy. So the prostate artery anatomy is very variant. So sometimes you may have some less frequent variants that you may run into problems. And finally, dealing with anastomosis. So there are a lot of different reasons why PAE can be a very technically demanding technique, and we'll try to, in a case-based manner, try to focus and discuss all of them. One of the main challenges with the IR practice and IR procedures is actually the level of evidence. So we've been evolving and maturing as a specialty, and this growing up is also accompanied by having more robust and better level of scientific data, and we need this. We need this to prove to ourselves and to patients and to other medical specialties that what we do is relevant and is actually effective and safe. And we've learned a lot, and especially with PAE, we've learned a lot about scientific data and level of evidence from uterine fibroid embolization. So we had to build a huge castle of evidence with UFE for the last 40 years. So we had to repeat that, and we had to repeat those data and those trials with PAE to prove everyone and our patients that that PAE is actually safe and effective. So we've had a lot of very relevant data, single arm prospective studies. We've had already randomized controlled trials, prospective trials comparing PAE with medical therapy, with surgical therapies, even with the sham procedure as ourselves as we did. So we have a robust level of evidence nowadays that allows us, for example, to be in the guidelines of the European Urology Association. So PAE is already a mature technique and accepted in the European guidelines. I printed out a lot of, because I mean, the CIRSE meeting is a huge meeting. So I was going through the program and trying, because it's so vast and so comprehensive that you really, there's a lot to choose from. So of course, I picked it out some obvious ones, because I think these are some sessions that I always go to, like the Joseph Roche lecture that will be on Sunday, and we have Gunnar Tipi. I mean, he's a class leading physician who will talk about a very very interesting topic nowadays about drug-eluting devices and where we at with all this confusion about drug-eluting angioplasty, and this will be one to see. and the hot topic symposiums. I mean, these are very important symposiums because they'll discuss about percutaneous arteriovenous fistula creation, which is a very new and very challenging and I think very promising clinical scenario, and of course lymphatic interventions, which are also very important. I'd also like to highlight that CIRSE has the upcoming clinical trials in interventional radiology. So there are a lot of sessions where you can meet the PIs and meet the most promising clinical trials that are under the way, which is also very good. And of course, first at CIRSE, which are featured papers, the most important scientific presentations. So with these kind of sessions, you can really have a feel of what's new and the most relevant clinical trials that are under the way during CIRSE.